Good morning. Good morning. Really appreciate being here, and it's just really amazing how different this conference is. Every conference has its place, but from the conversations I've had so far and meeting Antoine and Alex, it feels like we're in a room, a community of people who want to get their hands on in making the right kinds of changes in healthcare. It's really exciting to start addressing some of these issues and kind of thinking from each of our individual perspectives and each of the angles that we're coming from. When we think about things like value-based care and payment reform, why are we interested in subjects like that? It's because of all the people that are falling through the cracks or not served by by the status quo of the healthcare system. So when technologies like artificial intelligence start promising delivering conversations and insights at scale that can assist with patients, like the people in this room, the innovators and thinkers in this room, you start taking notice. You start asking questions on how can this have an impact on patients in the right way. But when you start looking deeper and the fact that these things are trained on existing data, on and practices that have reflect economic disparities, racial disparities, gender disparities, and everything like that, we start asking the other questions on how can we make sure that we're doing this in a way that doesn't perpetuate harm and perpetuate bias. So I've had some really exciting conversations, and I've seen Sanya Basarik of HHS speak a lot, and I'm eager to just get into some of these issues and some of these questions that y'all might be having, because ultimately, there's a lot of hype out there. There's a lot of shutsters and shills and things like that, and there's the people that have been doing this before it was cool. Sanya has been the chief, well, the AI lead for the Office of the Chief Health AI Officer in the Department of Health and Human Services, and it's before all this hype around ChatGPT came about, and we really want to get into some of the use cases that have been successful and provide an opportunity to lead by example. So Sanya, with that, super excited to start digging into the heart of these issues. Could you tell the audience a little bit about you?
Yes. Hey, y'all. First of all, I'm so happy to be here. Thank you for inviting me. I love it down here. I had some Carolina barbecue last night. Apparently, I'm considered young. That's amazing. Thank you. But so many important conversations to be had today and tomorrow, and I'm just thrilled to be a part of it. I'm Sanya Basarik. My title is AI Program Lead at the U.S. Department of Health and Human Services based in D.C.
And I forgot to introduce myself.
Yes.
I'm Chris Hemphill. My title is Senior Director of Commercial Intelligence and Meeting of the Minds podcast host for a company, a digital mental health company called Wobot Health. So basically I do data science projects for healthcare systems related to AI and conversational intelligence. And along with that, some of my work in the past in ethical AI research has also allowed me to be a fellow of the NYU McSilver Institute for Poverty Research and Social Justice. So we're excited to dig in. We're going to get into this fast because we hope we can have a little bit of time. I want to hear from everybody, like the types of questions that you have. But just getting started, Sanya, you've introduced, I think to a lot of people, you've introduced a new concept to people. Could you talk about what is the HHS's Office of the Chief Health AI? Like what is this?
Yes, good question. What is a Chief AI Office? Well, I think it's something that's being defined as we speak, right? Our Chief AI Office at HHS has been around for about 2 years. And in government terms, that's like brand new, right? Our goal is to scale and accelerate AI, trustworthy AI, I should say, across HHS. We're talking about a $3 trillion department that is massive, and I mean massive. We're talking about operational divisions such as NIH, FDA, CDC, CMS. These places are like entire planets on their own, right? And so we need a convening body within headquarters, which is what our office is, to really foster communication, collaboration, figure out how are we going to harness the potential of this technology while doing so in a trustworthy manner, right? And so that's a really fine balance. And that's something that HHS is struggling with right now, along with every single other agency, right? How do we get this right? How do we strike that balance?
Great, and y'all see me up here writing trustworthy. I'm signaling everybody should write down trustworthy AI because that's something that like when you're thinking about the types of approaches that are going to work, you'll find a large body of research if you look up things like trustworthy AI and responsible AI. So huge number of use cases, a huge amount of work that y'all are focused on. Could you talk about some of the projects, some of the use cases that have had the greatest impact?
Yeah, sure. It's hard to say which have had the greatest impact, but I will say that sometimes the AI work that is the most impactful is not the sexiest, right? Sometimes it's those internal operations. We're doing document AI. We're saving people time and money by doing something faster, by searching something faster, right? And so I want to focus on sometimes a great place to start is internal operations. What's something that is taking up so much time administratively within your organizations, and can AI help with that, right? When you talk about AI at HHS, we kind of think about 3 tiers of it. At the most granular is our use cases, and this is where we're using AI both operationally and on the mission support, right? We have AI for critical data analyses. We're analyzing adverse event reporting, claims data, grants data on the mission side. Internally, we're using AI for documents, for searches, for optimizing administrative processes, HR, recruiting, resolving cybersecurity issues with AI. And then on that next level, besides those use cases, we're also looking at AI on a more programmatic level, right? How can we actually create new programs or modify existing programs to enable AI integration into healthcare, right? So that means either standing up new programs. NIH's Bridges to AI program is creating flagship data sets that's going to allow our biomedical research data to be machine readable. FDA has issued a regulatory framework that allows FDA to more effectively and safely update AI in existing medical devices. By the way, as of today, FDA has over 500 AI-enabled medical devices approved. ONC, our Office of the National Coordinator, has issued a proposed rule that makes that increases algorithmic transparency in electronic medical records, right? So we're looking at AI not just from those use cases, but how can we actually integrate this into the healthcare ecosystem safely and responsibly? And then at the highest level, we're looking at AI policy and strategy. That's what my office is doing, right? How can we enable AI into just general data strategy? How can this really be a part of our every single day work? And how do we set the intent and direction of the department?
Great, and y'all, please listen in deep on some of the things that she's highlighting here. Is when we think about, you said 500 approved devices?
Yes.
So think about the rigor that it takes to go through the FDA's process. There's IRBs involved, there's randomized control trials involved, there's all kinds of things that just because there's some new technology, the science doesn't go away.
Right, right.
So just extremely impressive to hear about the work that's being enabled, but also be reminded of the fact that just because there's something new on the shelf doesn't mean that we change focus from the way that we have put out our devices and applications in the past. Now, in a lot of conversations, meeting people and discussing AI, like there's some darker elements that come up, and I think that it's important to have some of those in mind, but also important to focus on what's real, like the Terminator 2 scenario and everything like that. What were your thoughts on some of the hype that's around that?
Look, media isn't helping us much these days, right? And it's clickbait, right? I mean, their job is for people to click on articles, right? So what are you going to click on? Like AI is going to kill us all, or HHS trustworthy AI principles, right? Like that's easy, right? So I think that we have to be careful with the hype, and while there are potential harms of this, it's really what we make it, right? And so, but we've been here before, and that's something to keep in mind, right? This is a new technology. We've had new technology in the past, right? And we've dealt with it, and so we can do the same this time around. I think It's important for every organization to define AI in your own terms. What does AI mean to you? What are the values of your organization? And then have AI fit into your values, right? Not the other way around. We're not here to fit into a technology. We're here, the technology exists so that it serves us and it serves our values. So I think as long as we keep that in mind and keep having these conversations, we're gonna get past that Terminator hype, and we're going to see really amazing things come from this.
Absolutely major point to bring up there is, there's MIT actually in 2019, they did a study with hundreds of different business leaders who had launched AI projects, and they noted that 80% of those projects were failures. That 80% number, they said, okay, well, what divided that 80% from the 20% that was successful? And the 80% that failed, they had been pursuing it as a technology first, like, oh, this technology is really cool, it's really powerful, let's put it in place. Versus the 20% were focused on what's our organizational strategy and what are the things that we can do, what are the building blocks that we can put in place to fit that strategy. Those are the ones that succeeded.
Yeah.
Now, when we talk about that choice between clicking the Terminator 2 headline versus the trustworthy AI. Can you give a little headline on some of those trustworthy AI principles? Just I like the idea of like, let's get like, if we focus on those Terminator 2 problems, we forget about the real problems. But I'd like to hear about some of the real issues, biases, and things like that you're focused on.
Yeah, for sure,
solving.
for sure. So I want to say that we're not going to get rid of bias altogether, right? That's impossible. So we want to de-bias as much as possible. Sometimes bias is good, right? The question is it intended bias or is it unintended bias, right? Where we're going to fail with AI is if we just try to, just see what sticks, right? Just apply it to everything and not think about it. The key to successful AI deployment is actually to think about the entire use case before, right? Who is this going to impact? What are the potential effects of this? What data is going into this? Is our data representative? Probably not, because we don't have an equal and just representative society. That's just the truth, especially not in healthcare, right? So what data is going into this AI? Who is it going to affect? And I also want to make a really clear delineation. We talk about AI as this one group of technologies. There's so many different AIs, right? We have the good old-fashioned AI that we've seen produce great results. Now we have generative AI. That's a whole different animal, right? So we have to be really careful when we talk about AI and say, oh, AI should be regulated. Well, which type of AI? And what we're asking ourselves at HHS right now is this AI project going to affect the rights and the safety of Americans? And if that answer is yes, then we need to take a hard look at that project and make sure that we're putting the right guardrails in place and that there are checks and balances there before it gets deployed. Now, there is some AI that is totally fine, that has been producing fantastic results for years. It's not new, and maybe that doesn't need to be regulated as much as these new generative AI tools, right? So we have to really talk about, what actually should be regulated and not just say, oh, all AI needs to be regulated, all AI is bad. It's just not the truth.
Absolutely. And when we think about like coming regulations and the time that that's going to take versus the decisions that you're being faced with right now, as more and more vendors and strategic partners integrate AI into their solutions, there comes there are some questions that you need to be focused on before any kind of regulatory body can even get to these thousands of varied use cases. So I want everybody in this room to feel empowered, like when you were bringing up like the biases in data and things like that. Ask these vendors, ask these people that you're working with what they're doing in terms of their own hiring practices or in terms of addressing the bias that inevitably shows up in their data. These are questions that you don't have to have a PhD in artificial intelligence to ask. It's just important to have the courage and to have the will to be able to focus and say, hey, like that's a really cool demo and everything like that, but can you talk to me about what you're doing to address the underlying bias there?
Yes, absolutely. I also want to say, part of my job, I think about two things every day. Number one is, am I making informed decisions, right? From a policy perspective at, any sort of headquarters level, it's not just what Sonia thinks the issue in AI is, right? It is, I have to be talking to people who are actually doing the AI. I'm not. I've never written a line of code in my life. I don't own any data sets, right? I don't know what the issues are. So I have to be talking to people every single day. Are people on the ground doing the actual work to say, what are the issues? What are you concerned about? What can we do at a headquarters level to make your jobs easier? So constant communication, not just within HHS, but within our stakeholders, right? And that's the taxpayers. I mean, the money comes from taxpayers, which is all of us, right? And so making sure that we're representing the American people, companies, startups, payers, vendors, pharma, all of you guys, like your opinion matters. And there has never been, my one takeaway here, there's never been a more important time to be engaged with the government. We have to hear from you guys. People ask me, is the government going to regulate AI? I don't know. We don't know. We need to hear from you. Should we? Please tell us. Like, we have to hear from you guys. And there has been every single strategic plan, every single conversation I've been a part of in the past 6 months, there has been talk about engaging industry, engaging the taxpayer, engaging state, local governments, right? Those local communities that are so important. So please figure out which part of the government or HHS, aligns with your mission of your organization and engage with them. There are going to be roundtables. There's going to be discussion papers that are open for discussion. We want and need to hear from you guys.
I'd like to dig deeper into that, into that cycle between the public and the private partnership, because there's all kinds of entities. Could you talk about how you envision folks at healthcare systems or providers or at digital health companies? How do you envision that kind of public-private partnership?
Yeah, so in general, with the government, you either have a government grant or a government contract, right? But there has got to be more than that. It's not just an exchange of money for services or products. We have to have an exchange of conversations, right? So these roundtables, these discussions, things like this, where we're just talking without some sort of fancy written contract that takes like 6 months to do, we have to just keep having these conversations. And I'm seeing that more and more, right? Now, government does a terrible job of marketing, like by far. We post things on our websites, like who goes on government websites? I don't even go on government websites, and I work there. Like every single day, I'm gonna like check this .gov site. So we have to do a better job of getting the word out there, meeting people, especially young people, on the platforms that they're on, and making sure that they know about these opportunities and events. So it's on us, but it's a two-way street, right? We need you guys also to want to be engaged. And so I envision so many more just conversations. All this has to start with just conversations, right? Besides these fancy grants and contracts.
Yeah, absolutely. So it's extremely important to open up that door, and it's awesome to hear. Honestly, this is my first time hearing about like how open the door is, and how much the government is willing to receive information and hear from the people who have boots on the ground in this.
Yes. This is also sparking things beyond just AI. We're now being asked to review regulation and review rules that have been in place since, I don't know, 1940s, that things that are way overdue, past due for us to redo and take a look at and say, is this regulation and code in this agency still serving us today? Maybe it's time to rewrite it. And so it's sparking so many conversations about just the way things are done. And I've never been more optimistic about government's role in the healthcare ecosystem, and all the exciting things that AI is sparking besides just the technology.
So that's a tremendous point too, is that I don't know how many people in this room are developers or AI researchers or anything like that, but there are roles to play outside of just writing the code. Like you said, you haven't written a line of code, et cetera, but you come from a very important strategic perspective on AI. So there's a whole lot more for everyone to be able to focus on and be involved in this overall picture.
Yeah.
Well, you did bring up let's bring everybody into the conversation.
Let's do it.
And we have a few minutes left here.
Yeah.
Curious if there are any questions from the audience, which you can push a button, I believe, and
Hi.
oh, you
Hello.
look very official, by the way, by doing that. I like that.
This is like some sort of Congress or something.
Yeah.
Thank you. My name's Ed. I'm a nurse manager in Atlanta, Georgia.
Awesome.
I work in the emergency department at Grady Hospital.
Okay.
So one of the questions I had, just because my patient population that I have is pretty low income at a lot of times. Sometimes we get, people who are uneducated about, basic health needs or basic technology use in the hospital in general. But is there a plan from the Department of Health and Human Services to engage the community on an educational foundation? So making sure that people are, I guess, aware of just basic AI, like what does AI stand for? What does it mean?
Yes.
Because I can see it already just being integrated into EHRs and being integrated into, workflow of patient flow and things of that nature. So as far as just educating the public and integrating it into the basic curriculum, for even elementary level, I think that would be important. But I don't know if there's a plan already in place.
Yeah, that's a fantastic question. Yes, we're redoing our HHS AI strategy as we speak, as in this week, and the number one priority is training and education, right? We don't need everybody to be an expert on AI. I'm certainly never going to be an expert on it in terms of the technology, but we need everyone to have at least an awareness of it, a basic understanding, right? That goes to, from curriculum in terms of grade school, especially in terms of nursing and medical education. But we also need the public to be aware of it. And so this is going to become a public health campaign messaging, actually. And this will actually go down to state and local governments to do within their own communities. But it's going to be a major undertaking, but it's going to be very, very important. So a great question. Thank you.
Yeah, I just want to say thank you, Ed, too. And as an Atlanta resident, I wanted to also thank you for the work that you're doing at Grady. That serves a very needed population. And I just wanted to add as well, like at the organizational level, I think that there's a lot of distrust when it comes to people with their relationships with their healthcare providers. They don't understand how their data might be used for or against them. So I think that at an organizational level, by exercising transparency, informed consent, helping people to understand why we're collecting, like why we might be asking about sex and gender minority information or race information, and how you might be using that to help find programs that are appropriate for these populations. I think that goes a big way as well in educating the population as well. I saw a question here.
Hi, how are you collaborating with CMS on this as well?
Yeah, so CMS, Centers for Medicare and Medicaid Services, is one of our operating divisions within HHS. They are absolutely enormous. Just the Medicare program, right, is what, 7% of our GDP? We're not talking about just healthcare here. This is the economy of our nation, right? I don't think most people in the US realize just how large that program is, and it's only going to get larger, right? Because we're going to have an aging population. We collaborate with CMS all the time. They are very involved in actually deploying AI. Some of their one of my favorite use cases actually is machine learning for fraud, waste, and abuse of Medicare claims, right? This is costing taxpayers, I think the latest number is $65 billion a year in terms of fraud, waste, and abuse. And we are now seeing machine learning AI models really make an impact here, right? They're actually catching these providers quicker, faster, so that we can get those people out of the system and save taxpayer money. So CMS has great use cases, and they are very involved in our AI strategy.
I see you.
Not sure if I know how to use this, but
Master.
I am
Do it.
learning. So nice to meet you. Thank you so much for your presentation. And my name is Carrie, and I work at UNC Greensboro, helping future public health leaders become future public health leaders. And what you mentioned about DHHS working to make the system more efficient, I think my question revolves around local public health. We saw a lot of that inefficiency, and during the COVID-19 pandemic, especially with messaging. And so I'm wondering, how is the AI program at the federal level sort of filtering down into implementation at the local and state public health departments, so that they can improve their efficiency, especially since public health has a much more restricted budget than healthcare. And just curious if you all are working with local public health at the state and local level.
Yeah, great question. Not yet, but we will, and we should be doing that more, right? What I took away from the pandemic is that we are in a federalist society, right? States have a lot of power to decide what goes on in the states, right? And we can only do so much from a federal level, right? We can say, you know, this is the federal law, but the states are really going to set their own laws, and they're going to set their own messaging, and they're going to set their own standards, right? So, but we do need better communication with state and local hospitals and communities and health centers, and that is on our agenda also.
You were first.
Hi, I'm Andrew. I'm a director of health at IDEO. And I'm curious, you talked a lot about optimism with AI. I know I've seen iRobot way too many times, but I'm curious, being at the 5-year anniversary of the Young Health Leader Summit, if you were to imagine 5 years out, what is your most optimistic view of where AI takes us, particularly in healthcare?
Oh, that's a good question. I think we can, if we do this right, we're going to see money saved in the healthcare system. I mean, right now, healthcare is unsustainable, right? In terms of cost, in terms of equality, in terms of pretty much everything, right? And my optimistic view is that AI is actually going to help us become more sustainable, more equitable if we do this right.
And I'll throw in a view too, just around the experience that clinicians have, like working within like a lot of some of the crushing bureaucratic tasks and things like that. If the presence of AI allows people to better focus on delivering care, like do what they came in to do, then I think that the better experience for our clinicians, doctors, nurses should translate to better experiences for patients as well.
1,000%. That clinician burnout, it's real, right? And if AI can help with those mundane tasks of taking notes of EHRs and help people actually just have more time for their actual jobs, right? If we can get to people who live in rural communities better and faster with AI, if we can increase communication, increase care, make better decisions faster, right? Catch those clinical decisions that are not being made well, triage people better when they come into the hospital, right? There's so many potential great uses of this, and I'm optimistic that in 5 years we're going to see all of that happening.
So there's healthcare optimist hats out here that Antoine has, and I think that like with a couple of minutes left, Sonia, I wonder what would be like, knowing what we've learned even up here, hearing from all the people in the room. What's your call to action to make this public-private partnership that you were discussing? What's your call to action to make it work?
I would say, you know, I'll just reiterate on what I already said. Please be engaged. Please engage with the government, your local, state, and federal government. Engage with your representatives, right? They're representing you guys on a federal level also. Find out what's happening and be part of that conversation, because we really need you guys in this, right? And so just have more conversations with each other, learn about AI, learn about what others are doing in AI, and don't be afraid of it, right? Log on to ChatGPT, play around with it, right? We have to lower that barrier to entry. It's not scary, right? Actually read an interesting stat the other day, 14% of Americans have even used ChatGPT, only 14%, right? And we're going to have AI making major decisions for us, and people don't even know what this is, right? So educate yourselves and then spread the word within your own communities, within your organizations, and please engage and get involved with federal government.
And all I can say is you're in the driver's seat. Like hearing that 14% number, it does fall on everyone to at least know what these technologies are doing, kind of like at least have a flavor of it, so that you can better understand, like once you're presented with those kinds of decisions, come from a much more informed perspective.
Absolutely.
Well, thank you all very much. I've loved the open conversation here. Wish it could have gone on longer, but we're going to both be around for the next little while. So I've seen a lot of the conversation happening in the hallway.
Yeah.
If you have any deeper questions, we're right here.
Thank you guys so much.